Good afternoon, everybody. Thank you for joining us. I would like to start today by thanking the countless volunteers, clerks, election officials, members of the National Guard, and voters who made Tuesday's election such a great success. Whether folks voted in person or by mail, local election officials and volunteers worked diligently and thoughtfully to ensure that every Wisconsinite was able to make sure that their vote was counted and their voices were heard safely. In support of these efforts, nearly 700 citizens, soldiers, and airmen of the National Guard supported polling places in 40 counties across Wisconsin. And that's in addition to the nearly 1,100 members already mobilized in our COVID-19 response efforts. I'm incredibly grateful to all the folks who pitched in to make sure democracy prevailed even during these unprecedented and challenging times. That said, the November general election will be here before you know it. So make sure to make a plan to vote and request your absentee ballot by myvote.wisconsin.gov. Unfortunately, however, on Tuesday we also hit another mark in this pandemic. It is with heavy heart that we announced that in just over 6 months, Wisconsin's COVID-19 death toll has surpassed 1,000 people. Even one death from COVID-19 is one too many. This is a devastating milestone, and every corner of Wisconsin has felt the tragic impact of this virus, as 52 of Wisconsin's 72 counties have reported at least one COVID-19 death. We also know this virus has a disproportionate impact on communities of color, with Black, Latinx, and Indigenous Wisconsinites having higher rates of COVID-19 infections and deaths. The infection rate for Latinx Wisconsinites is over 5 times that of white Wisconsinites, and Black Wisconsinites are experiencing a death rate over 4 times higher than their white counterparts. To all the Wisconsinites dealing with the loss of a family member, friend, a coworker, or a neighbor, I express my deepest condolences. Know that our hearts and thoughts are with you, and we are going to continue doing everything we can to fight this virus that has already taken the lives of so many people across the state. Finally, as we continue to navigate the COVID-19 pandemic and continue to work on Wisconsin's economic recovery, we want to ensure that we are providing transparent and up-to-date information on how and where we are investing Wisconsin's share of federal funding. That's why today I am happy to announce that we are launching Wisconsin's COVID-19 Response and Recovery Investment Dashboard. This website will allow Wisconsinites to see for themselves how our investments, totaling $1.73 billion so far, are helping your neighbors and communities, from our $200 million Roots to Recovery initiative to the $25 million Wisconsin Rental Assistance Program to the $50 million Wisconsin Farm Support Payment Program. In just a few short months, we've been able to put more than 10 million pieces of personal protective equipment and more than 1 million testing and lab supplies into the hands of local communities and our tribal partners. We've also invested in more than 12,000 small businesses and provided an additional support to nearly 12,000 Wisconsin farms. And folks, the impact of our investments keep growing. So visit www.doa.wi.gov and click the Response and Recovery Investment link to see how we're investing in creating a Wisconsin that works for everyone. Folks, it's on each and every one of us to do our part to stop the spread of this deadly virus. For the health and safety of our friends, family, neighbors, and fellow Wisconsinites, it's really important. Please continue to stay home whenever you're able. Limit your social service and limit your social circle and practice physical distancing, and wear a mask whenever you are out. Working together to box in this virus can and will save lives. So let's do this together for each other, Wisconsin. Now, I'd like to turn it over to Secretary Designee Andrea Palm for her update. Andrea?
Thanks, Governor. Good afternoon, everyone, and thanks for joining us again today. Box in the virus, stop the spread, flatten the curve. Those of us working in public health have been using these phrases for a while now, but I know that they've only become a topic of more general conversation in recent months. And because we've grown accustomed to them, it's easy to use them without really thinking about what they mean and what they tell us about where we are in this pandemic and how we can make decisions that are the safest possible choices. So I want to take just a moment to expand on them. When we talk about boxing in the virus, we're talking about identifying where the virus is and making sure that it stays there. That means we're talking about testing, tracing, and isolation and quarantine. In Wisconsin, we have critical in-state lab capacity, so if you have symptoms or have been exposed to COVID-19, please get tested. And we have some important news to share today about our testing efforts. Through funding from the Federal CARES Act, healthcare providers, as well as their local and tribal health department partners, can apply for reimbursement for testing. The $45 million allocated for the COVID-19 testing payment program will help remove barriers by providing financial support to organizations staffing up local testing, and in turn, increase access to testing across the state. Contact tracing is also integral to boxing in the virus. Once someone tests positive, they need to be contacted to advise them on their need to isolate from others and to determine who else needs to be notified of a potential exposure. At the state level, we have 229 employees working to assist local and tribal health departments with contact tracing. And our local and tribal health department partners have 1,128 staff available to work on contact tracing, with an additional 182 staff trained and ready for potential surge response at the local level. When you test, when you answer the phone call from a contact tracer, and when you isolate and quarantine as necessary, you are boxing in the virus. This is a collaborative effort between DHS, local and tribal health departments, healthcare providers, and the residents of Wisconsin. So in stopping the spread, we each stop the spread when we stay at home and limit our trips to the essentials, when we wear a face mask, when we practice social distancing, and when we wash our hands for at least 20 seconds. When each of us takes these actions, each of us is doing our part, and we can all stop the spread of COVID-19 together. Doing our part at DHS includes giving you the most up-to-date data. Here are where things stand today. We have 1,035,195 negative tests, which is an increase of 11,472 over yesterday. There are now 63,206 confirmed cases of COVID-19 here in Wisconsin, which is an increase of 943 over yesterday. Our total deaths have now reached 1,018. I know our numbers can feel discouraging, but we've flattened the curve before, and we can do it again. By boxing in the virus, by stopping the spread, we can reduce transmission, and that is how we reflatten the curve here in Wisconsin. Thank you.